Hi, my name is Dr. Vanessa Nahoul Serio. I am a psychoanalyst, current president of the Institute for Clinical and Social Psychological Research in Mexico City, and I am also a member of IAN UK. I have my clinical practice here in Mexico City. And first of all, I would like to thank Dr. Mario Marrone for inviting me to conduct this interview with Dr. Howard Steele. Mario Marrone has been a very important promoter of the attachment theory all around the world, who worked closely with Dr. John Bowlby at the Tavistock Clinic in London for 10 years. And he has written books that have also contributed to the expansion and advancement of the theory. I would also like to thank Nicolas Lorenzini for his collaboration in making this interview. He's a member of the executive committee of IAN UK and currently lives in Berlin, but works at the University College London. Dr. Howard Steele, thank you for accepting this interview. It is a great pleasure to meet you. And first of all, before I introduce you formally, would you please tell us how is your connection with IAN UK and how did you meet Mario and the colleagues?
Thank you so much. It's a pleasure to be talking to you. I met Mario and Marrone and Tyrrell Harris in the late 1980s in London. Together with my wife and colleague Miriam Steele, we moved to London, England in 1986, and we actually remained there for 18 years. And in the late 1980s, there were still meetings that were convened by John Bowlby. He had the tradition going back to the 1950s of holding monthly meetings with diverse professionals who had a shared interest in children and parents. So in the 1950s, Pearl King, Christoph Heinecke were part of that group, Robert Hind, and over the years, Tyrrell Harris became a regular member of it, also Mario Marrone. And I remember presenting to that group with Miriam Steele and Peter Fonagy on our intergenerational patterns of attachment research. And then when John Bowlby died in 1990, there was a wish to continue with these kinds of meetings where clinicians, researchers, practitioners would continue to meet and discuss and present ideas. And Mario and Tyrrell formed the idea of a network, an attachment network, came to be called International Attachment Network. And then I remember getting a call from Tyrrell Harris. This is long before Zoom and people relying very much on email. It was the early days of email. But Tyrrell phoned me and said that, sometime in the 1990s, and she said, we need an attachment journal. Routledge, which was later bought up by Taylor and Francis, Routledge, which was later bought up by Taylor and Francis, had reached out to Tyrrell and said, let's get an attachment journal started. And Tyrrell turned to me and asked me if I would get involved in editing the journal, that it should have a university base. And I was at University College then. And so by 1999, the journal launched, and we're in our 21st year now. And that's the story. And members of the International Attachment Network receive with their membership a subscription to Attachment and Human Development, the journal that came out of that conversation with Tyrrell. And I have also, more recently in the last decade, started a learned society called the Society for Emotion and Attachment Studies, SEAS. And members of that learned society also received the journal as part of their package. So the International Attachment Network and Society for Emotion Attachment Studies have an affiliation that I'm very, very proud of. And I'm very fond of Mario and Tyrrell, who I've known for more than 30 years.
Now allow me to introduce Dr. Howard Steele. Howard Steele earned his PhD with an investigation into intergenerational patterns of attachment and the psychometric qualities of the adult attachment interview in 1991 at University College London, having received PhD supervision from Peter Fonagy and John Bowlby. Howard's PhD, together with the PhD work of his wife and colleague Miriam Steele, gave rise to the concept of reflective functioning. Howard remained at University College London as a lecturer and senior lecturer through 2004, when he moved to New York City and joined the clinical faculty at the New School for Social Research. Currently, he is professor and chair of clinical psychology at the New School for Social Research in New York City. At the New School, Dr. Steele co-directs with Dr. Miriam Steele the Center for Attachment Research. Howard Steele is also senior and founding editor of the international journal Attachment and Human Development and founding president of the Society for Emotion and Attachment Studies. Together with Miriam Steele and Dan Murphy, Howard Steele helped pioneer and test the efficacy of the group attachment-based intervention, GABI or GABI, currently being delivered in all 5 boroughs of New York City, supported by the Administration of Children's Services, New York City. Howard Steele was among the 2017 Bowlby Ainsworth awardees, so recognized by the Center for Mental Health Promotion for his contribution as, I quote, a scientist, editor, and clinical innovator, end of quote. Howard Steele and Miriam Steele are co-editors of the 2008 book, Clinical Applications of the Adult Attachment Interview, and the 2018 Handbook of Attachment-Based Interventions, both published by the Guilford Press in New York. The Steeles are members of the Adult Attachment Interview Trainers Consortium. It's a great pleasure to have this conversation with you, Dr. Steele, inspired by your article entitled COVID-19, Fear and Future, an Attachment Perspective. So I would like to start by saying that in this article, you state among many interesting ideas that mentalizing fear may have benefits in coping with COVID-19 information. Let me ask you first, which differences do you think there are between the individuals with secure attachment from those with insecure, dismissive, or ambivalent attachment, or even disorganized attachment, for being capable of mentalizing fear in this COVID-19 threat?
Thank you. It's a great question. I would say that a fundamental difference between children and adults with secure attachment, as opposed to others who have one or more insecure attachments, is that when the person with secure attachment feels distress or fear, they have a singular question in mind, and that is, where is my mother? Where is my father? Where is my romantic partner? I need to talk to them about my feelings. I need a cuddle. I need a hug. I need contact and conversation. I need to try and make sense and make meaning of this puzzling situation that we're living in across the globe. For the person with insecurities in their attachment, there's many questions arising. One is, can I even acknowledge this fear? And can I share it with others? What will they say? What will they do? Will I feel ashamed? Will I feel threatened? Maybe I'll be belittled and ridiculed for mentioning that I feel afraid. And of course, the central lesson of attachment theory is that when someone feels ashamed or feels ridiculed or feels fear of being shamed, a fear of being ridiculed, then there have been, in their experience, important caregiving figures who have shamed them, who have made them feel afraid. So the freedom with which we access and express our emotions is related to our attachment history. And we have to encourage everyone to share their feelings and to believe that the other person who's asking, how are you, is really interested in how they're feeling and wanting to help sort out the negative feelings, the fear, the anxiety, and to make plans for the future as well as come up with a meaningful account of how we got to this place.
In your article, you also note that according to Bowlby, based on Freud's ideas, the fundamental anxiety in human life is fear of loss of love, or fears following from actual loss of the loved ones. Why and how are these fears activated in COVID-19 times?
Thank you. I mean, the question comes back to the very origins of attachment theory. The trilogy that Bowlby came up with, that we have on our shelves, attachment, separation, loss. It was his brilliant idea to extract from Freudian theory, which is 26 volumes, as we know, immense. Bowlby would say that he follows Freud to about 1900, but not much beyond. Of course, we know that up until the interpretation of Dream Book, Freud was understanding the clinical difficulties of his patients in terms of overwhelming negative feelings, anxiety and fear that they had encountered, typically in early childhood. These it was not possible to express them in an organized way with caregivers, so those feelings were suppressed, locked away. But according to Freud's early thinking, they need to find their way out in the course of development. Well, Bowlby thought that was a good account of how people function in anxiety-provoking situations when the attachment system is activated. And he dipped into inhibition symptoms and anxieties, Freud's book, where Freud talks about all kinds of anxieties, including annihilation anxiety, castration anxiety, and, as you comment, anxiety over loss of loved ones, or fear of loss of loved ones, anxiety over separation. And it's those three, separation anxiety, fear of loss of love, and the fears and disrupted behavior and emotions we feel after a sudden loss of a loved one. Bowlby said, that's it. That's what we have to focus on. And if we can help people arrive at organized thinking and feeling around separation and loss, fears of separation and loss, we can help them cope. We can help them become the adaptive human beings that they aim to be. So that's the relevance of those fears and anxieties, relevance to attachment theory, and the relevance to the present moment of COVID-19 when we see tragic circumstances. The news today is that over 200,000 people around the globe, 50,000 in the United States, 20,000 in the UK, people who have died on account of this virus. And we know that the circumstances in which people are dying are in isolation and alone. The family members are not there to hold their hand or to share last words. And so there is this sudden, painful separation, final separation for so many people around the globe. And from the attachment theory perspective, we're very sensitized to this. And we know that this is precisely the kind of loss experience that is likely to lead to disorganization and disorientation. What Bowlby said is the typical response to loss, but in the fullness of time, people find their way and begin to focus on living loved family members and friends, as opposed to being totally absorbed in the painful feelings of loss about a family member who has died. So attachment theory and clinicians and researchers working with the model have a reliable kind of resource to turn to help people in these quite challenging and tragic times. I'll say one other thing. I know you're a psychoanalyst. The psychoanalysis, the defining feature of it is that we're influenced by things we can't see, things that are unconscious, preconscious, deeply unconscious. So the COVID-19 virus is, of course, invisible. And therefore, I think psychoanalysts, particularly attachment-informed ones, have a special role to play in helping individuals, families, and the wider society making sense of this moment.
And which fear do you think operates in these cases, both in the infected individual as in its attachment figures? The fear of being left alone and thus without love, or the fear of not being able to be around and protect those whom he loves?
The brief article that you refer to, COVID-19 fear, an attachment perspective, and the future, remarks upon both the relational anxiety, worry about loved ones, as well as annihilation anxiety that Otto Rank talked about, and Becker in his book, The Denial of Death. And I contrast those two models of anxiety, annihilation anxiety and separation anxiety. Annihilation anxiety is fear over one's own death, which, of course, for all of us is inevitable. And out of that idea emerged terror management theory, the idea that the greatest terror is the existential fear of one's own death or demise. But the interesting thing, when what we're hearing about these patients who go into ICU and do share text and telephone communications, what they're most afraid of is the lack of contact with loved ones, the family that they're leaving behind, which highlights the fact that separation anxiety and attachment theory is more deeply relevant to the human condition than terror management theory. And we know that terror with respect to our own death, or what are called mortality salience images, the images and stories we hear of ICU units with healthcare workers being overburdened and taxed, and gurneys lined up with patients and body bags. These are mortality salient images. They make us think about death. And the question is, what do we do with those thoughts? Do we worry about ourself alone, or do we worry about our family, our friends, our neighborhood? And I think what we're learning is that people are worried, yes, about themselves, but also very centrally about other people. And so we have many impressive stories, images, films about the way in which across the world people are lending a hand to one another in these moments. In New York City, I think around the world, it's 7 p.m. every evening. It'll be in 30 minutes. You can open your door, or perhaps not even open your door. You hear people singing, applauding, making noise out of appreciation for the healthcare workers in the front lines, protecting our families and friends.
Pandemics, you say also in the article, activate the conspiracy theories, especially in those who have a history of difficulties in attachment. Why do you think this happens?
Well, as I said earlier, people with insecurities of attachment have had adverse experiences, have had the experience of, from early childhood and continuing perhaps, of being frequently mistreated, shamed, made to feel bad. And we know that one of the easiest psychic mechanisms for dealing with negative feelings or fears in ourself, one of the easiest responses is to blame other people, to turn what is an inner experience into an outer expression through displacement, projection, and so on, primitive defense mechanisms. And we know from the research on terror management theory, when people are presented with these mortality salient images, there's an increase in that kind of xenophobic in-group, out-group thinking. So just as we've seen throughout history in times of economic distress, and this is, of course, a public health crisis, but also economic downturn that's affecting very many people. We have already in the United States some 27 million unemployed. And I'm not suggesting that all those unemployed people are prone to wild conspiracy theories, but some of them who are coping not only with unemployment, but with a history of trauma and adversity in their background might well be looking for an easy solution, which is to believe that China's to blame, or Asian people are to blame, or the Jews are to blame. That's a favorite target across centuries. And of course, these xenophobic tendencies are in healthy societies monitored, controlled, and in a critical way, not approved, not given sanction by political leaders. But a strange feature of our present time is that we have political leaders in many countries who are themselves looking for a quick and easy solution and suggesting that the cure is easy and the cause is easy to think about. And these are the sources of conspiracy theories that eat away at the fabric of open democratic societies.
Do you think that under these circumstances, it is likely that the magic thought is also activated? Like the animistic, magical way of thinking?
Oh, I think so. I think so. Just as the virus is hidden, invisible, and calls back to kind of early pre-scientific times, I think there's a thought that there's some quick, invisible solution we could solve. Like, you know, in the United States, I'm smiling because we've had this latest 24-hour news cycle around the fact that our president seemed to be suggesting that people could inject Lysol or bleach and that would purify them and protect them against the virus. Someone advised him to claim that he was just being sarcastic and cynical. In the meantime, the Food and Drug Administration in the United States and the producers of bleach and Lysol have had to be very deliberate in their messaging that this is not wise. This will attack your organs, cause heart failure, internal bleeding, and lead to a quick death if you follow this advice. So yes, magical thinking is typical of early childhood. 3, 4, 5 years of age. We know that these are the magic years, according to Selma Freyberg. And in these years, we engage in all kinds of fantastical, magical thinking. And it's normal in those years. Sadly, we see adults who, in their mental and emotional functioning, slip back to where they were as a 4-year-old. And we have to encourage them to be 11-year-olds who are more sensible than to believe in conspiracy theories or magical thinking.
And do you think this magic thought emerges in light of their feeling of vulnerability and impotence?
I think so, definitely. Impotence, threat, and it's not simply the virus, but we've been living for many years with many threats to our well-being on a global scale. And I want to refer here to climate change, because many commentators are rightly pointing out that we'll get through this. We'll wear masks. We'll wash our hands. 12 months, 18 months. There'll be a vaccine, perhaps. There'll be a herd immunity. We'll get back to some way of interacting in a more typical fashion. But the question is, do we want to go back to how we were? And I think very many people would say we don't want to go back to the way things were. We want to imagine a new future where we're better protected against viruses, better protected against wild forest fires that Australia experienced early this year, storms and extreme weather processes. Here in New York, we lived through the Sandy storm where some years ago, And I recall everybody being quarantined for a short period in their homes while we waited for the storm to pass, for electricity to return. I know that there are places in the world, the Netherlands, for example, where there have been seawalls created at enormous expense that are extraordinarily functional against rising sea levels and offer great protection to the Dutch people. And here in the United States, there are plans to create seawalls around New York City. And the latest news is that the budget for those has been spent on the public health crisis. And it'll be some time before the funds can be reassembled for that preparation to take place. But the funds have to be found, and we have to take measures to protect ourselves and our children and children, because the planet is crying a huge distress sign from the planet, and many have said that this is just what the virus is doing. It's as if Mother Nature is telling all of us to go to our rooms and think about what we've done.
That's right. I have noticed in Mexico City that adolescent patients are assaulted by catastrophic ideas, meaning they say that after COVID-19 pandemic is over, there will be an enormous earthquake taking place. And you know that Mexico City has been vulnerable to Mexico City and Mexico, the country Mexico, no? We've been vulnerable to devastating earthquakes in the past. So one of these catastrophic ideas is that after the pandemic is over, there will be an enormous earthquake taking place. And after that, a meteorite will fall into the earth. Why do you think these catastrophic ideas are emerging?
I think that we know that catastrophic fantasies are common for children who have experienced extreme traumatic events. To the extent that COVID-19 is an extreme traumatic event, there will be many of us who are having nightmares, dreaming of further catastrophic events. And what you describe, the meteor doesn't sound so reasonable, but the earthquake, we know, is not a crazy thought. Such events have happened. And like COVID-19, sadly, when those catastrophic events occur, they affect the people differentially. And poor people in the United States, Black and brown people, are disproportionately affected by the virus. I think earthquakes and tsunamis are disproportionately in their adverse influences. They're disproportionately distributed, and poor people living in shelters that are not so secure as the brick houses on the hill that well-off people live in. The latter group are better protected, and we have to try and navigate the future to spread those wings of protection across all of the Mexican community, all of the American community, to try and raise up people who are living in poverty and create opportunities for them in a way that we have not done so to date. I think that's got to be part of the reaction, and then maybe that's a way of turning these worries and catastrophic fantasies into productive plans and action.
Okay, thank you. But do you think they reflect a suspension or an inhibition in the capacity to mentalize?
Well, we know that the secure attachment is associated with moderate mentalizing skills, thinking about feelings and thoughts and linking them to behavior in oneself and others, and being able to make meaning of one's past experiences and plan for the future. But also we know that people who've experienced adversities and receive support from a teacher, from a therapist, from a romantic partner, that they are well placed to quickly develop trust and mentalizing skills that they did not have in early childhood. And sometimes those mentalizing skills that are acquired despite an early experience that didn't provide the opportunities are the most compelling and effective. So I think for clinicians hearing this, I think it's all the more reason to work in a way with one's patients to promote trust and mentalizing so that people can feel safer in their relationships and families and contribute to building a brighter future for themselves and the world that we live in.
One more thing about these catastrophic ideas and the conspiracy theories. Do you think they could also reflect an inhibition or an incapacity for the reflective functioning?
Well, we know that on the reflective functioning scale, which is an 11-point scale running from -1 to 9, 9 is perfection, and, but 4 is community level, people who are somewhere between low and moderate levels. They manage, they sometimes feel dysregulated, there's a rupture in their interactions, but with effort they can repair things. The low scores of 0 and -1 are the most worrisome. 0 is the absence, complete inhibition of mentalization. -1 is hostility toward the task. So we see hostility toward mentalization frequently among many adults, and many of them powerful and well resourced, but nonetheless showing hostility to the process of looking at the evidence, examining it, making conclusions and predictions about the future. Here in the United States, we have, I think around the globe as well, very many politicians who point to the most thoughtful publications and say about them, this is fake news. That's an example of inhibited, low, aggressive response to the task of making sense of where we are, which is there's no simple answer. But we have to begin with conversation with other people where we're open to hearing their point of view.
What kind of psychological help can one give to these individuals who suffer from lack of mentalization and these catastrophic ideas? And
well, I had the good fortune for my doctoral research, as you mentioned at the beginning of the interview, of working with supervision from John Bowlby on the one hand and Peter Fonagy on the other. Well, as you know, Peter Fonagy and his colleagues, Anthony Bateman and Pascal Firon and many others, Mary Target, have developed and tested all range of mentalization-based treatments. They first of all showed that you could apply that model with people with borderline personality disorder. So we know that people with BPD, these are people with complicated, adverse histories, often involving physical and sexual abuse. If those individuals can be helped to achieve a mentalizing outcome, as we know from the work of Bateman and Fonagy, then people dealing with anxiety, with depression, with some of the catastrophic fantasies you mentioned, they can be helped by attachment-informed therapists who, as we know from John Bowlby, the first task is to establish a safe haven, secure-based relationship where there's a level of trust, and then to explore what's going on in the current life of the individual, and then very carefully explore how current circumstances, relationships at work or with family members, how those reflect childhood attachment relationships. And the way in which we function is patterned. There's organization to our functioning. And we can nonetheless change how we manage. We can update our models. We can acknowledge a pattern and say that we're not going to follow that pattern anymore. I think this must be the goal for the therapeutic work we do with individuals, as well as the work we do at a social political level to try and influence change across the world?
This morning, I was listening to some psychotherapists who were saying their patients were very worried because in their workplace, there were groups of people who didn't accept the measures required, the official measures required to be safe. They didn't want to use the alcohol. They didn't want to use anything to cover the mask to cover their mouths, and we were talking about this apparent denial that anything is going on. What would you say that this why does this happen when we have lots of evidence that effectively there's a virus that is taking away many lives? No.
Yeah, this phenomenon of people who are behaving in disobedient, reckless way, not following the advice to wear a mask outside. It's now the law in New York City, and who are shirking, showing a level of disbelief in the guidelines. And I think there's two. We have to ask. We have to understand this in two ways. That it's a deficit in the response of the people, but it's also a deficit in the guidelines that are being announced and the level of support that is being provided in terms of testing and contact tracing and clear messaging from our political leaders. Certainly, we've lacked clear messaging here in the United States from the White House. We're subjected on a daily basis to these briefings from the president. Already a few weeks ago, there was one television group in Washington State who said we're not going to broadcast these as live anymore. And I think that was a very wise decision, because the job of journalism is to process and digest the information that's available out there. So I think if one trusts in the journalistic source, one would not be inclined to disregard the guidelines. But we have here in the United States, you probably have in Mexico, and I know elsewhere in the world as well, these tabloid publications that are functioning to address the 3 and 4 year old self in everyone, to come up with magical, clear solutions where blame is placed and it's not about you. You don't have to follow these guidelines. People are trying to control you. So it's associated with the conspiracy theorizing and the magical thinking that this is not required of me. It's quite deeply narcissistic and entitled to think that I can go outside and go to the beach with my friends and disregard the rules and guidelines. So it's frustrating and difficult to remain indoors, but I think we must hope for consistent messaging from our political leaders and seek out truthful accounts of what this virus is about, how deadly it can be, and what we need to do to protect our family and ourselves. It's not just young people; it's it's all range of individuals. It would be worth doing a study to find out if adherence to these guidelines is at all associated to attachment, individual differences in attachment. I'd like to think that people with a secure attachment recognize the limits that are in place and realize they're there for our safety and well-being, and that those who are behaving in a reckless fashion are perhaps more likely motivated by underlying insecurities.
In the article, you also say that infants with a secure attachment to their primary caregiver, typically the mother, are less prone to the experience of anxiety and fear. Yet over time, as language develops, these securely attached children are significantly more likely to have words that permit them to label and discuss their feelings, including fear. And a negative feeling labeled and discussed safely with others is a less threatening feeling. Would you like to add anything else to this idea, which among others, I think is one of the, it's a central idea, no, in the article.
It is a central idea in the article. It's what we mean by mentalizing fear. Parents do this in their conversations with children. Children can't mentalize on their own, not at 2, 3, 4 years of age. They show kind of precursor early signs of it with passing theory of mind tasks and so on. But young children who are extremely attentive to tone of voice and facial expression of caregivers, but also to what caregivers say. So we know that people who care for their own children or care for grandchildren or other children, they ought to be answering the questions that children bring and doing so in a way that welcomes conversation, welcomes an expression of their feelings, and provides a context for their feelings, validating those feelings. And when that happens, children feel that it's safe to share their sadness and anger and distress with their attachment figures, with their mothers, with their fathers. And out of that will come a natural ability to seek out assistance when we don't feel we can manage on our own. This goes back to my earlier comment about secure attachment. When the securely attached child is distressed, there's one question in mind. Where's the mother? Where's the father? I want to talk to them. And sadly, children who are, certainly children who are on an avoidant path, they're taught to hold it inside, share positive emotion, but don't share negative emotion. And then children who are anxious, resistant, crying on reunion and inconsolable, they have expressed their negative emotion, but it's not received in a balanced and organized way that helps them calm down and settle. Parents can learn from our conversation to simply ask on a regular basis, at least once a day or more, how are you feeling? And being present for the child to hear the answer and to engage in a shared narrative that provides a meaningful context for the feelings that are being expressed.
Thank you. I was just wondering if it would be useful for adults to have like a social way of mentalizing fears with other adults, no?
For
Like
sure. Absolutely. And the central message here is simply that we should find occasions to talk about our worries, talk about our concerns, talk about our fears. And the surprising thing is we'll find that if we show this willingness with other family members, they will also share their feelings with us. We have to be ready to listen in a non-judgmental and open way, but good things will follow. And it's at the heart of the psychotherapeutic enterprise with children and adults to put feelings into words. The more we can do that, the less threatened we'll feel by fear and those feelings that are left unnamed.
Dr. Howard Steele, thank you. Thank you very much for your article. Thank you for your time for this interview and for continuing with this research on attachment. I am really grateful for
Thank
your
you so
time.
much for the time. Good to meet you.